So virtually all units in the UK will have, in the smaller units, the paediatricians will not only do the general paediatrics, the sick children who come through the door, but also the level 2 neonatal care. For level 3 neonatal care, you'll almost certainly now have a specialist rota of consultants, of middle grade and of SHOs. So there will be 3 levels of neonatal intensive care. Level 3 is the highest. They will have their own dedicated consultant, their own dedicated middle grade and their own dedicated junior doctors. And they would care for all aspects, apart from surgical perhaps. At level 2, they wouldn't have a separate middle grade or consultant rota. They would be safe for stabilising and sicker children and for looking after not so sick children. And then level 1 would be a very basic level of care. Again, we have too many level 3, level 2 units in Wales, and there needs to be a concentration of the level 3 expertise, and we need to concentrate the level 2 units. So again, there is an expertise in looking after these small number of babies. I think this is unclear, and I think the decisions will come down to middle grade availability. If you project the number of middle grade we've got, it's unlikely that we have the middle grade to sustain 3 level 3 neonatal units in South Wales. The options then are to have either a consultant delivered service, whether you can have some form of staff grades, which seems very unlikely, whether you can train up nurses to function at a middle grade on a neonatal unit, but that doesn't seem to be an option anywhere in the UK that works, and that would take, consensus is probably 5 years of training to get there. So the options in the medium and even perhaps the short term is that we're either going to need to go to 2 level 3 units, or there will need to be a rethinking of how 1 or 2 of those units are staffed. Before the financial crisis came, we have been saying that Wales needs safe, sustainable, quality services, and irrespective of the financial implications, we were pushing and have pushed towards a move to a smaller number of units where children can get the best service.